For next speaker, I would like to introduce Dr. Rohit Shetty. And he is my good friend and also my mentor in Silk. And his talk is about the impact of the nerve regeneration in wound healing post-LASIK. Okay, let's welcome.
Thank you, Dr. Chang. Can you play my slides, please? So, Dr. Maipal sir has made our job much easy by covering up the entire aspects of silk and how the journey of silk has moved from a very, very hesitant stage when we both were very hesitant new surgeons during COVID to what we are today. I've been part of the J&J's journey with silk for the last 5 years now. So before we go into the whole concept about nerve regeneration or nerve tracking, we have to have a brief understanding about corneal nerves in health and disease. I don't need to explain this whole, the structure, the anatomical structure of the nerves, but what is very important is the corneal nerves are very closely related to the epithelium, and each of these corneal nerves here have one branch which has into every epithelial cells. The corneal nerves and epithelium are like oligodendrocytes in the nervous system. That means your corneal nerves have a covering, because we don't have myelin, because these coverings are from the epithelial cells. This has a huge impact in the hemostasis between a corneal nerve and an epithelium, which becomes a very integral part of the healing process in any refractive procedures. If you're looking at the three dynamics, the corneal nerves, the corneal epithelium, and ocular surface cells, apart from the energies, apart from the skill, apart from all the beautiful technologies we've been offered to, what really drives your quality of life is these three fundamental factors. This is how a corneal nerve is. This is how a corneal nerve relates to epithelium. But corneal nerves also are linked to the keratocytes, which is the very important factors in your wow, especially when you're looking at a refractive surgery. Why? Because these keratocytes play a tremendously important role in the health of your eye and also helps in healing. So if your nerves are linked both to the superior structures and also linked to every keratocyte cells, which needs to secrete a collagen, which needs to secrete healing, which needs to bring out a change in your myofibroblasts. This is an interesting paper which talks about it. When the nerve fibers are cut by refractive surgery or lasers, what happens is you activate the keratocytes, and these keratocytes are driven by factors called the TGF-beta, the same factors which causes the corneal dystrophies, the same factors which causes your changes in your trabeculectomy, multiple things. And these myofibroblasts needs to heal faster because the nerves had to bring in a lot of growth factors, which has to change how the myofibroblasts change. These are all very fundamental ways of how cornea healing happens. And why do we need all this is because we need to understand if you can do anything by minimizing the amount of nerve damage, we might actually make epithelium to heal faster, and we might actually help the corneal keratocytes to become less aggressive. So we use confocal microscopy to study a lot of these things, and this is how confocal microscopies look: the epithelium, the corneal nerves, the keratocytes, and endothelium. We also use a beautiful software by Sysmetrics. It's an offline software to look at corneal nerves, the corneal branchings, the corneal length, and every aspect. This was designed by an endocrinologist from he was Pakistani but works in Oman, and this is such a beautiful thing because he used to work on diabetic retinopathies and how this diabetic retinopathy have an impact on the corneal nerves. So he was kind enough to give us the software, so we use this a lot in our analysis. So let's look at nerve tracking in laser versus non-lenticle procedures. We know how it works. What we believe is the profile and both the energies, you know, the precision of your laser spots, the low energies, both have an impact in the corneal nerve. This is a research question we need to ask. When we looked at the LASIK, we all know about how the nerve cuts are, but the same thing, if you see uh, the, the, the ELITA here, the nerves hardly show any changes. In fact, we might see some amount of branching, which is normally how it heals. But when we look at other lenticle procedures, you see that all procedures will damage corneal nerves. It's not that it will not damage corneal nerves. Silk also changes corneal nerves. It's all about relative, whether it does more or less. You can see that the recovery is much faster, much quicker. And we did some analysis. I just showed you some of those analysis. We did analysis. Silk also drops down, but the drop and recovery was very fast. And you can see that most of those factors match. And this is on the lenticule. With other CLEX procedures, you can have multiple things, but we have not compared every one of them, but at least some of them which have a similar profile. So it significantly better pattern observed with silk. Now, when we look at nerves, the first thing which comes to mind is dry eye. Dry eye is not the only one which is driven by the nerves, because if you look at a corneal nerves here, this is what a traditional cornea of a patient coming to you who's been contact lens wearer, and this is what happens. He is contact lens intolerance, high dry eye. Molecularly, he has a lot of these factors here. We call it as dendritic cells, antigen presenting cells, and T lymphocytes, which are all floating out here. If you have 10 patients, you will have 10 of them with this contact lens and all these things having the same picture. And you do a procedure, and you're already working on a very angry keratocytes, the bright keratocytes which are angry, and you do a procedure on them, your corneal nerves heal completely differently. That means a healthy cornea heals faster, but when you have a LASIK here, if you have a more inflamed eye, for example, your cornea nerves hardly heals even after 9 months. But here in silk, even with an inflamed eye, it's not as great as a healthy eye, but it's still healing. So what's beautiful here is, in today's 2025, your people are working for long hours, you are exposed to a lot of toxic light, you're exposed to environment. Your corneal nerve healing is not the same as a normal versus an ocular surface immune changed eyes. So what is important is every biology is different. And the most important thing for me is not dry eye. Most important thing is how the cornea remodels. Because entire aspect of healing is driven by how the epithelium remodels. For example, if your epithelium is not remodeling well, it can induce multiple changes. This again the same picture. Remember this nerves. Nerves have an impact on the nerves, on the epithelium and the keratocytes. And you can get this heaped up epithelium, which is very commonly seen after any refractive surgery like LASIK and other procedures. And what happens is, look at the healthy ones and unhealthy nerves, and because those are all epithelial cells, which are breathing epithelial cells, real ones, with those messengers out there. And these are dry cells, dry eye, epithelial cells with dry eye. And you look at this, what happens to them is completely different. Let's go back to the same nerves. A healthy nerves make the epithelium to heal better. And you can see that all the greens here means we all know that pre and post was good. Just 2 months back, I started using a new technology, very, very innovative technology company called AIOS. They have their booth here with Tosh Bro. They do a ray tracing of every layer of your eyes. We all have ray tracing by InnoVise, but that's one big model, but it's like every level. I'm so fascinated by optics and biology that whenever new things comes, I always try to put and go and try to understand. And this is an epithelial ray tracing, stromal and everything. So that means you know that I'm working on how the epithelium is remodeling. Very interesting thing. This was a patient referred to me from Chandigarh, post smile, and he's written a lot of blogs about being very unhappy. And he says that he's so unhappy that he says that people should never get this kind of procedures. I'm not sure whether it was one of the Klex procedures. I don't remember exactly. I didn't bother also. But what you really see is that this is a ray tracing of the epithelial map. That means it refractive part of the epithelium, which shows that he's refractively ray tracing is showing a diopter of refraction compared to the just outside the pupil. And what is important is this is when I started looking at more and more of LASIK and non proper healing epithelial maps, you see a lot of ray tracing happening, which we were never able to pick up because most of the time epithelial maps comes like this. It doesn't give you thickness map is not refractive maps. But when you start comparing the real thing, then I told him your problem is in the epithelium. It's not the surgeon has. I've never seen such a beautiful surgery. I told him I would be so happy. I don't know who surgeon is, but it's one of the best smile surgery. You can't even make out anything. But your problem is you're healed in such a way that it is causing you problems. And then I said that the only way down is that you can do a ray tracing epithelial topo-guided treatment. That means you can knock out only those irregular epithelium without knocking up the stroma. And then we started looking at, me and Pooja started looking at what kind of smile, silk, AIOS, Zimmer, what are they doing? And also the Wavelight Plus on the epithelium. And what's interesting here is when it creates least amount of changes on ray tracing, you mean you reach the perfection of healing. Because that is what is important. And this is, look at different refractive procedures. Look at the amount of refractive changes it's causing on the epithelium. This is something very new data, and I'm working on it, but I feel the quality of your wow is tremendously dependent on quality of your epithelium, and that depends heavily on the quality of nerves. And this is a few cases I've done. Beautifully, it looks at all the maps out here, and this is self-explanatory. We need to look at the immune profiling, and this is what we work on, which will be commercially available by January. Now I can openly, proudly say that. And this is the same patient, the gentleman from Chandigarh. Look at this. This is his epithelium, which is irregular, and the same patient's nerve has not regenerated at all. He has got two small nerves, which ends with a small microneuroma filled with T lymphocytes and a few dendritic antigen presenting cells. And look at this, biomarkers are very high. Classic sign of inflammation because of nerve regeneration leading to epithelial remodeling and patient being unhappy. Now, I don't want to do a PRK on him because if you do a PRK, he will end up, even if I do a PRK of 0 microns, he'll end up in a haze because T lymphocyte secretes TNF alphas and that causes haze. So I had to give him at least 3 months of lifitegrast because that is works on there is a combination handshake here happening between T lymphocytes and the dendritic cells. This handshake releases the factors, and that factor is what causes the haze. So we need to take care of that. And this is what happens when there's high inflammation, the WOW, less WOW, when you have a lot of edemas out there. And this is when you have a healthy ocular surface, you can see that there's no change in your biomarkers and reports at all. I'll just take a minute on this because you have patients coming to you with symptoms. Nerves are not just for dry eye. Nerves are for nociception. If all of you sitting here are comfortable, that means your nociceptive factors are perfect. But we checked this nociceptive score. That means how much are you intolerant to things which should not be intolerant to. For example, sunlight, AC, somebody speaking loudly, or just cold water. What we found was the silk surgery had the least amount of nociception. I'm not looking at dry eye. Let's forget about dry eye. I don't tell my patients I'm getting less dry eye. What I tell them is, I'm getting you factors which bothers you. If I link this one, your quality of life drops down significantly, whether you do cataract or refractive surgery, when you have a higher level of nociception. That means the quality of life is not driven by dry eye. It's a wrong word to use. It's the nociceptive factors. And what drives the nociceptive factors? Every epithelial cells have these channels. These channels are the ones which are responsible for the state of well-being where you are comfortable. And this is a beautiful picture drawn by one of my fellows, which talks about the pathway. This happens at every single epithelial cell of yours. And what's important is when you preserve these cells, when you don't disturb them, when the nerve healing is better, when your TPRME is better, that's what brings you relief when you put cold water into your eyes. That's when you get the perfect thing. And this is exactly the work we have been doing. So to summarize, corneal nerve preservation is not dry eye only. It's all about the complete well-being. It's about nociception. That is what we need to address to our patient. Silk is definitely a nerve sparing. Mechanism of it is challenging uh, to, to whether it's the energy or it's the shape. It's a big debate. Nociception, good nociception is quality of life. Epithelial remodeling is probably the most important thing what I give Silk today, because that is what makes your quality of vision to change. Thank you.